Hello everyone, and welcome to the first video in a series of short webinars that the Minnesota Health Literacy Partnership has created for its annual Health Literacy Month campaign. My name is Hannah Garasu, and I'm the Summer 2022 intern at the Minnesota Health Literacy Partnership. This year, the theme of the partnership's Health Literacy Month campaign is Back to Basics. We chose this theme because it allows us to reflect on key health literacy concepts from previous years and explore how these concepts have changed over time. In this video, I'll be discussing how the definition of health literacy has changed over time since the term health literacy first appeared in the 1970s. As you can see here, we'll talk about a significant document called the Calgary Charter on Health Literacy that provided a more comprehensive definition of health literacy. Lastly, we'll touch on current definitions of health literacy and also discuss why health literacy is still a relevant topic and issue today. To begin, let's take a look at when health literacy was first introduced as a concept. The term health literacy dates back to 1974, when it first appeared in an academic research paper titled Health Education as Social Policy. In the paper, author Dr. Scott K. Simmons describes health literacy as health education meeting minimum standards for all grade school levels. The link between health literacy and health education that Dr. Simmons describes in his 1974 paper is a key part of health literacy as we understand it today. Health education is something we'll discuss further in the next two webinars, which focus on the teach-back method and plain language use for improving health literacy. Several decades after Dr. Simmons' research paper was published, another event shaped the evolution of health literacy. In 2011, the Center for Literacy of Quebec published a landmark document titled the Calgary Charter on Health Literacy. The charter provided a more comprehensive description of health literacy, including a wide range of skills such as reading, writing, listening, and critical analysis that allow people to act on information to live healthier lives. As an early leader in health literacy research and advocacy, the Center for Literacy of Quebec helped to improve understanding of health literacy around the world. The Calgary Charter remains a historic, groundbreaking research study on health literacy that takes account of the skills and abilities associated with individual health literacy, as well as the cultural, social, economic, and policy issues associated with health systems. Let's now review how health literacy is defined today. A well-known and well-respected program called Healthy People, which promotes national health and well-being goals set by the U.S. Department of Health and Human Services, has historically provided definitions of health literacy every 10 years. Healthy People 2030, the newest version of Healthy People, updated the definition of health literacy to reflect the role of organizations in the delivery of quality health information and services. Healthy People 2030 breaks down health literacy into two categories: personal health literacy and organizational health literacy. These are defined as follows. Personal health literacy is, quote, the degree to which individuals can find, understand, and use health information and services to make health-related decisions. Organizational health literacy is, quote, the degree to which organizations equitably enable individuals to find, understand, and use health information and services to make health-related decisions. Like Healthy People 2030, the Minnesota Health Literacy Partnership also acknowledges the dual roles of individuals and organizations in its definition of health literacy. The partnership defines health literacy as 1. A patient's ability to obtain, understand, and act on information. as well as 2, the capacity of healthcare providers and healthcare systems to communicate clearly, educate about health, and empower patients. It's clear from these up-to-date definitions of health literacy that individuals should not bear sole responsibility for understanding and using health information. This dual emphasis reflects the messaging put forward in the Calgary Charter on health literacy over a decade ago. I'd like to take a moment now to address what some of you may be thinking. Why are we still talking about health literacy in 2022? After all, in this modern age of smart devices, the internet, social media, and so on, don't we have everything we need to understand health information well enough? The short answer to this question is no. For a number of reasons, health literacy remains an issue to this day. While many individuals are well equipped to understand health information, others simply lack the resources and knowledge to understand and act on health information. Unfortunately, there are gaps in high-speed internet access across the country, and even in areas where high-speed internet is readily available, some individuals lack either the technology or the skills to use technology in order to access, understand, and use health information. Beyond the issues of access and resources, communication and language are also factors to consider when thinking about health literacy. Even people with high health literacy skills or a college-level education still struggle to understand doctors' recommendations during a health appointment. Sometimes, health information is presented in a way that uses very technical or scientific words that are unfamiliar to a patient, and the patient may feel uncomfortable asking a doctor, nurse, or other health worker to explain the information again in simpler terms. It's important to note the cost of health literacy in the U.S. Over 1/3 of adults in the U.S. have low health literacy, and low health literacy is estimated to cost the U.S. economy as much as $236 billion every year. This enormous financial cost is attributed to the many impacts of low health literacy, such as medical errors, increased illness and disability, loss of wages, and compromised public health. We've spent a bit of time in this webinar discussing why health literacy is still a relevant topic and how low health literacy can impact individuals and communities. This leads us to the next webinar, which focuses on the teach-back method, a tool that was developed to address the issue of health literacy and help patients get the most out of their health appointments. Thank you for tuning into this first webinar, and I'll see you in the next one.